when you looked at the original TFOS DEWS definition from 2007, what was the discussion like about what was missing? What did we get right? What did we get wrong? And how do we approach a new definition? Jennifer, you want to comment on that?
Yeah, well, I mean, I think one of the first things was the symptoms. So in the earlier definition, there had been very much the focus on discomfort and on visual disturbance. And one of the things that we realized was that it could be described in other ways. I mean, generally, those are the main symptoms that patients will complain of. But we were conscious that we wanted to make a definition that was global, that would work across the world. And when you talk to people in different countries, they say, oh, that's not how our patients will describe dry eye disease. You know, so for example, in Japan, it's more about having tired, heavy eyes, more than about having, they won't want to come up and actually say, I have uncomfortable eyes or discomfort straight off. So one of the things that we did, you'll see that it's in the definition now, it's accompanied by ocular symptoms. So what we tried to do there was to broaden it out, to not just limit it to ocular discomfort or visual disturbance, but to allow for other symptoms that may be associated or may be the way in which patients describe their dry eye disease. And it's not, I know some people have said, oh, it should have discomfort in there. It's not taking away the discomfort. We've very much acknowledged that, you know, discomfort and visual disturbance are probably the two key symptoms that patients will complain of. But that was one of the particular things that we did.